Today I thought we might talk about discs. We hear a lot about discs and back injury and aches and pains and so forth. So between each vertebra, well almost most vertebra, you don't have a disc right down here where your sacrum, your lower back joins onto your lumbar, and you don't have a disc right up here, C1, C2. But everywhere else you've got a disc. As we go down the spine, from the head up here, right down to your pelvis, the discs get bigger because the load is greater. Obviously the load, the amount of gravity pushing down in this area, your head, is significantly less than the amount of gravity further down here. The purpose of discs are to act, as I said, as a shock absorber, but they also help maintain mobility. So up here we've got a lot of mobility. My neck can go up and down, side to side. This thoracic area between my shoulder blades, down the midline there, less so. Mainly the movement with rotation. And then the lumbar, obviously we've got a massive amount of movement in that lumbar area for bending down and so forth. As we go through the day, the gravity pushing down more and more on the disc, we actually get shorter. So lying in bed at night time sleeping, and then the gravity's off your discs and you gain a little bit of height. So the role of the disc is a shock absorber and to help with mobility. Where things go wrong with a disc is when we load up the spine too much or we don't look after the discs. So let's have a look at the makeup of a disc. On the outside of the disc you've got collagen, annulus fibrosus, which is almost like a mesh that's holding in the inner gel. The inner gel, nucleus pulposus, is the shock absorber component. So what can happen? We lift something incorrectly, we move incorrectly, have a bit of trauma, incorrect load, we can then damage the outer fibrosis, the collagen, and then some of the inner gel can sometimes leak out, or the disc can just be squeezed. When that does, it generally happens at the back here, and it pinches the nerves that come out of your vertebra. So these little yellow guys are the nerves. So you imagine the disc then has problems here, with the pressure it starts to rupture, or bulge a little bit, pressing on the nerve, and that can cause terrible, terrible nerve pain. Get pain going down your leg, which we call sciatica, because that's a sciatic nerve. Sciatic nerve is the thickness of your thumb. There's an awful lot you can do with Myopractic to help discs. The main reason being is because it's your muscles that are moving your vertebra. So if your vertebra is out of place and a disc is under load, under pressure, we can take that pressure off the muscles. To give you an idea, if you have a look at the vertebra, excuse my lucky band holding this guy together, and you can see there's a whole lot of spines off the vertebra. The reason being is the muscle will go from here across to there to allow more movement, more leverage on your vertebra. Myopractic, we flick the muscles gently, take the pressure off the muscles, the vertebra then go back into place, and the disc can then restore normal function. Most of the time Myopractic is very, very successful at treating bulging discs, protruding discs, and that sciatic pain that we sometimes get. I'm happy to have a chat on the phone if you've got some queries and let you know whether I think Myopractic would be suitable to help you. I'm Michael, the MyBack Myopractor in Bunbury.
Call Michael for an appointment at MyBack Myopractic 0438 339 001. Give Michael a call for an appointment today.